The foreign ministers of China, Afghanistan, Bangladesh, Nepal, Pakistan, and Sri Lanka jointly held a video conference on COVID-19 on Tuesday. As the virus flares across several countries in the region, what proposals were discussed? What challenges lie ahead, and what role can China play? I'm joined here in Beijing by Zun Ahmedhan, researcher at Tsinghua University. By Skype from Manila by Professor Madhav Nalapat from the Department of Geopolitics and International Relations at India's Manipal University. And on the phone by Ying, Vice President of the China Institute of International Studies. President Rong, let me go to you first. China's Foreign Minister Wang Yi stressed how timely, necessary, and fruitful, in his own words, this conference was as countries in the region face this new wave of the pandemic. Just how important was this meeting and in its ability to address these challenges?
Well, the conference itself, of course, is being planned and prepared much earlier. But I think it is very timely in the sense that we are seeing with great regret that the region as a whole, and India in particular, is hitting by the second wave of the pandemic and causing a lot of damages and also difficulties, sufferings to the region as a whole and India in particular. So if you look at the agreements, look at the messages in particular, and also the initiative that has been reached, I think that they're very important and very productive. That's exactly as Wang Yi and other ministers that participated the conference said, that it shows the solidarity between China and the region as a whole. And it is also, I think, with concrete and specific sort of steps that hopefully will help address the region as a whole, to help the region to manage and address the current crisis.
Right. Zun, what do you make of the significance of this meeting?
Well, firstly, I think I'll definitely agree with what Professor Ying just said, that it's a very important situation. It's a very dire situation that South Asia is in right now. So before I get into what's the significance, let's also talk about the kind of images, the kind of videos that are going viral coming out of India, watching people suffer like this. It's also in Pakistan, other South Asian countries, and we see worldwide people are really touched, and they're trying to find any way possible to help. So, of course, in India, we see a spike, which is 4 times worse than what was the peak last year, and we are still far from plateauing. In other South Asian countries, absolutely every country is also experiencing a spike. And what we're seeing now is that young people are losing their lives, even if they haven't had prior health complications. So this is definitely a time where all South Asian countries, absolutely every country in the region, is in need of help, is in need of support. And China, being a country that has deep cooperation with most of countries in the region and has successful experience in combating the virus, this conference seems to be very timely. I'll also add one more thing, that SARC as an organization has not been very functional, and this concept of SARC plus China has been pitted before to improve the level of cooperation and coordination between countries in the region. So I think if China steps up, and in this period, especially in this a very testing period, comes up with solutions for the region, it can lead to, in the future, more positive levels of cooperation. So I think it's a drastic situation indeed.
Yeah, let me turn to Professor Nalapat in India. I mean, as an Indian scholar, how do you look at what this meeting has achieved?
Well, the bit of good news today is that Dr. Manmohan Singh, 89 years old, 2 open heart surgeries, multiple other medical problems. He has just been discharged from hospital after having been cured of COVID. So the reality is that if you have the therapeutics available, if you have the oxygen available, well, this is a disease that can be tackled. and deaths can be reduced to a very low level. Yes, India has got a very bad case. The spike is huge, and there are two reasons for that. One is there was a lot of complacency, and the result is that over 8 or 9 months, there was no real effort to ramp up spectacularly either therapeutics or oxygen supply. It's not the total production of oxygen, it's the logistics involved in ensuring that the supply reaches across the country, especially in zones that are at risk. This was not done. So we have this problem. But the reality of the situation is that what is happening in India, what's happening in the rest of South Asia, it indicates two things. One, we have got to understand that this is a pandemic where deaths can be reduced to a minimum. And even in India, I know it sounds very odd for someone to say that, but the deaths per million are much lower than for almost any country in Europe, for example. But the reality is very simple. The whole world has got to come together in this particular
Yeah, we do hope
pandemic.
things will get under control in India soon, Professor Nalapat. Now, let me go back to our friend in Beijing, President Rong Ying. China expressed its willingness to establish a China-South Asia emergency supplies reserve through consultation with all parties based on the proposals from all countries. How do you see this, proposal working?
Yeah, before I answer your question, I would like to once again express our sympathy, deep, profound sympathy to friend, Mr. Professor Nalapat, a good friend of mine. I wish him and his family, and of course all the Indian colleagues, friends, good well. Indeed, I think if you look at the situation in India, it's been very difficult situation, and of course it's related to the medical supplies and also the logistic arrangement. So that is where exactly I think the initiative of a kind of emergency or relief reservoir reserve is going to help. And I think the idea, of course, it is to put some necessary materials, supplies, medical supplies in the region, so that whenever a situation like we are having now will arise, then it will be available. It will be available in the sense that it is close to the location, and more importantly, I think it would also reduce the other complications and logistics, things like that. And that has successful experiences in other regions. And I think we only hope that with initiative and a facility like that, it would help the region to address the emergencies, natural disasters, and things like, which has been very much, I think, for the region is very much prone to that. There are so many emergencies and natural disasters, things like that. So the need is all there. And China put forward that initiative, and it is, I think, meant to help the region to address these cases, urgencies like that.
Yeah, Zoom, Wang Yi said that under the framework of the 6-country cooperation mechanism, people in South Asia will have access to more diversified and stable vaccine supplies. How do you see the role of China in fighting the virus and in general, and providing vaccines in particular?
I think one thing that's come out of this entire situation, the unfortunate situation that India finds itself in, is that all of the countries that were dependent on India for vaccine supplies are being impacted. So a lesson that we learn out of this unfortunate incident is that everyone needs to diversify a little bit, especially when you're relying on a country that itself is fighting against COVID-19. So for China to step up right now and suggest that let's help countries diversify, if certain populations can use the Indian vaccine, especially if they were already purchasing it, but let's shift to the Chinese Chinese one as well. I think this is a pragmatic way forward. And for countries in self-interest, they definitely should think about the pandemic before any political excuses or whatever you want to call that. So I think definitely China offering to support comes from experience domestically, having successfully fought. And it's not just about supplying vaccines or PPEs, but also helping countries strategize. And this is exactly the kind of help that we've seen pouring out since last year, when especially countries, I can give you Pakistan's example, we were fighting the locust infestation as well as COVID-19 at the same time. And the cooperation with China was not just about receiving supplies and much needed equipment, but also about helping figure out how to move forward, what policies to pursue, how to conduct lockdowns or partial lockdowns when certain areas were caught off guard. So I think definitely this is sort of the holistic approach that China would also pursue. And another thing, for people who think that this meeting was just talking about an overall policy, overall posture for countries, we see that in terms of the BRI and also SCO cooperation, the idea is to think of an overall policy and then the exact situation of each country. Coordination on a bilateral level can determine the specific of this cooperation. So this is another thing to note, that every country in South Asia has a unique situation, has unique needs, and those need to be met based on bilateral coordination.
Right, and now let me turn to our colleague, Professor Nalapat in India. Let me ask you this, Professor. What kind of support does India need from the international community right now?
Well, I'd like to say that the support that's needed, because we have a temporary problem, and the problem is that we didn't sufficiently ramp up the logistics of supply of oxygen and therapeutics early enough. I think, quite frankly, we were taken by surprise. From November onwards, there was a lot of complacency, but now things are being ramped up over the last 3 weeks. And production is now coming up. But for the next, I would say, 5 or 6 weeks, we'll certainly be needing concentrators of oxygen. I noticed that we have been getting it from the different countries. Russia has been among the first to give it to us. The United States, now China. We need help in the production of therapeutics and vaccines. The Americans have come forward with that. India can produce vaccines. I mean, 90% of the vaccine, of the therapeutics for AIDS comes from India. We can produce 60 to 70% of the vaccines the world needs. But for that, now roadblocks, administrative roadblocks need to be removed, and the whole world has got to chip in. I am happy to see that this horrible crisis that we are facing now, well, that has concentrated minds in India. And I'd like to say I'm very heartened by the response across the world to India. And that response is now helping us to cope these very difficult few weeks before our own production goes up to scale.
Yeah, we do hope for an early end to this virus, this pandemic. Thank you so much, Professor Madhav Nalapat from the Department of Geopolitics at India's Manipal University. President Rong Ying, Zhu Ahmed Han, thank you all so very much. And that would do it for this edition of The Point. I'm Wang Guan, sitting in for Liu Xin, and thank you so much for tuning in.